Miscarriage can be a challenging experience, and understanding what could cause it can help on the journey of being a parent. So, in today's video, we'll explain common causes of miscarriage. This video is part 1 in the series related to miscarriage, so do well to watch others when they are happy. In this series, we will shed light on the complexities surrounding this sensitive issue called miscarriage. So, to start with, what is a miscarriage? A miscarriage is the loss of a pregnancy before the pregnancy is 12 weeks, that is 5 months. Most miscarriages happen in the first trimester of pregnancy. Before the end of the 12 weeks of pregnancy, there are several factors that could lead to a miscarriage. But before I go ahead, I would like to let you know that to a large extent, we might not be able to tell you all the reasons why a miscarriage happens. But we have pointers that shows what contributed to a miscarriage. So, let's look at type of miscarriage. The first one is the missed miscarriage. When we say missed miscarriage, the pregnancy loss has happened, but the woman does not know it has happened. There was no symptoms of miscarriage, but when a scan is done, it confirms that the growing baby has no heartbeat. Then we also have the complete miscarriage. Here, the pregnancy loss has happened and the womb is completely empty. The woman has experienced bleeding and she has passed the fetal tissues out. Usually, when a scan is done, you can confirm a complete miscarriage has occurred. The third one is the recurrent miscarriage. This is when a woman has had at least 3 consecutive miscarriages. It affects about 1% of couples that have miscarriage. We also have the threatened miscarriage. Here, upon checking by your doctor, a woman's cervix stays closed, but bleeding and pelvic cramping happens. The pregnancy typically continues with no further issues, but this pregnancy requires close monitoring to progress. We also have the inevitable miscarriage. The woman is bleeding, she is cramping, and the cervix has started to open, that is, it has started to dilate. Fluid might be leaking too. Here, a complete miscarriage is most likely to occur. Then what causes miscarriage? Let's look at some of the causes of miscarriage. The first one is chromosomal abnormalities, which causes about 50% of all miscarriages in the first trimester up to 13 weeks of pregnancy. Chromosomes are tiny structures inside the cells of your body that carries your genes. Genes determines all a person's physical attributes such as sex, hair, and eye color, even the blood type. So, during fertilization, when the egg and the sperm join, 2 sets of chromosomes comes together. If an egg or sperm has more or fewer chromosomes than normal, the fetus will have an abnormal number. As the fertilized egg grows into a fetus, its cells divide and multiply several times. Abnormalities during this process can also lead to a miscarriage. Most chromosomal problem occurs by chance. It is not completely known why this happens. Now, let's discuss something that hits close to home for many, which is hormone imbalance, specifically low progesterone. In my practice, I have found out that most women who experience miscarriages before the 12th week, this is the problem for most of them. Hormones have a lot of work to do in this miraculous journey called pregnancy. When progesterone, the hormone crucial for maintaining the uterine lining, is insufficient, it can lead to a heartbreaking outcome called miscarriage. That is why it is important to check a woman's progesterone level early in pregnancy and within the first 12 weeks. For women with issues like PCOS, this is one of the major causes of miscarriage they experience. Now, let's dive into factors that plays a role in miscarriages, yet it is not often discussed: the cervical incompetence. Imagine the cervix as a gate of the womb of a woman that is closed once pregnancy is confirmed, ensuring the safety of the developing life within. Sometimes, due to various reasons, these gates may not close well and thus might be slightly open. As such, it may not be able to provide the necessary support for the growing baby, leading to a miscarriage. Often, This happens more in the second trimester when the weight of the baby has started increasing. Another known cause of miscarriages are infections. Our body are resilient, but certain infections can pose a threat during pregnancy. From bacterial vaginosis to urinary tract infections, these unseen invaders can disturb the environment where the baby is growing. Lastly, we will look at the uterine abnormalities. The uterus, also known as the womb, is nurturing home for a growing life. But what happens when it has some issues like fibroid that may prevent the fetus from staying well in the body? Then a miscarriage might occur. So this can also contribute to a miscarriage. Now, we may not be able to exhaust all the causes of miscarriage, but this can be said to contribute to most of the miscarriages we observe with our clients. How many people have miscarriages when they get pregnant? Between 10% and 20% of all known pregnancies end in miscarriage. Most miscarriages, 80%, happen within the first 3 months of pregnancy, up to 13 weeks of pregnancy. Less than 5% of miscarriages occur after 20 weeks gestation. I want you to note something. The rate of miscarriage may even be higher if you consider miscarriage that happens shortly after implantation. A person might not realize they are even pregnant because bleeding happens around the time of their menstrual period. This is called a chemical pregnancy. So, how can you tell if you are having a period or a miscarriage? When trying to distinguish between a period and a miscarriage, there are several factors to consider. The first one is the symptoms. Severe or worsening back abdominal pain as well as passing fluid and large clots could indicate a miscarriage. The time, a miscarriage very early in pregnancy can be mistaken for a period. However, this is less likely after 8 weeks into a pregnancy. Duration of symptoms. The symptoms of a miscarriage typically get worse and last longer than that of a period. In conclusion, miscarriage is a journey marked by grief and questions. By unraveling these common causes, we hope to foster understanding and support for those who have experienced or are currently navigating this challenging path. Remember, knowledge is a powerful tool on this journey, and together we can foster empathy, awareness, and healing. If you found this information valuable, don't forget to like, share, and subscribe.